Welcome to the Restraint Station, where we will be reviewing both clinical and behavioral restraints. What are restraints? A restraint is any method or device, manual, physical, or mechanical, that limits a patient's ability to move freely their arms, legs, body, or head. Here at Kaiser, we use two types of restraints: soft restraints, or nonviolent, non-behavioral, and hard restraints, or violent, or behavioral. We do not use chemical restraints at our facilities. We medicate for psychosis or medicate for agitation. That is not considered a chemical restraint. On the screen are examples of your soft restraints and hard restraints that you may see at our facilities. Please note that mittens and vests are rarely used, as mittens are considered the most restrictive type of soft restraint. Restraints. Soft restraints may be placed first, but requires a medical practitioner order, so you're going to notify them immediately. You must document every 2 hours on the flow sheet. You must do range of motion every 2 hours and do neurovascular checks to ensure the restraints are not too tight. You must discontinue the restraints if the patient is no longer moving or pulling or interfering with care. These orders must be renewed daily at midnight. There is no 24-hour on the dot clock. If your patient is unresponsive or a code blue, the restraints are no longer needed, so we must remove the restraints and document the time we remove the restraints. Hard restraints. Hard restraints may also be applied first, but require a medical practitioner order, so notify them immediately. The physician must assess the patient within 1 hour and renew that face-to-face assessment every 24 hours. Every 15 minutes, you're documenting the behavior and mental status, comfort, circulation, and continuous observation. Every 2 hours, you're documenting nutrition, hydration, elimination, range of motion, and need for continued restraint. When doing range of motion, please remember to release and reapply one limb at a time. You'll discontinue restraints if the patient no longer exhibits the behavior. For restraint order renewal frequency, it is dependent on the age of the patient. If the patient is over 18 years old, a new order is needed every 4 hours. If the patient is between 9 to 17 years old, a new order is needed every 2 hours. And if the patient is less than 9 years old, a new order is needed every hour. Again, if this patient is non-responsive or a code blue, there is no longer a need for the restraints. The restraints must be removed and documented as such. When documenting restraints, the documentation must match the physician order. Here we can see in the clinical order, the reason for the restraints is pulling at tubes and lines. Therefore, in the RN documentation for clinical justification must match pulling at tubes and lines. This is an example of the clinical restraint flow sheet. Documentation on this flow sheet is every 2 hours. Initially, when applying the restraints, you must document alternatives to restraints. Here you may see the options for your alternatives to restraints. What else did you try? Then clinical justification, which must match your order. Then education. Was usage and removal explained, and what was the patient's response? And then family notification. If there's no family at bedside, that's fine. You just cannot leave this box blank. Then every 2 hours, you're documenting everything in this flow sheet. We cannot have anything blank in this section. If you start your restraints at an odd time, you are able to document more frequently to get to a nice time. You just cannot document less frequently. Example, the behavioral restraint flow sheet. When starting documentation, we must document alternatives to restraints. Here are your examples of different alternatives you may chart. We must also document clinical justification. This clinical justification must match what is on the order. Then we go down to education, usage and removal explained, patient response, and family notification. Again, if there's no family at bedside, we do not need to find family, but if they are here, we need to document that we've educated them. Then every 15 minutes, we are documenting all 4 boxes. And every 2 hours, we're documenting these 4 boxes. If the patient arrives in the field in restraints, we do not chart continued. we chart start as we are starting our own restraints. You are also able to change these times and assess more frequently to make these times look nicer for your Q 15-minute assessments. Under behavior mental status, if you are documenting sleeping for multiple 15-minute episodes, then your restraint should start to be removed because no one is sleeping and agitated. If they are intermittently agitated, then please document as such to justify your need to keep the patient in restraints. Sitter and qualified professional observation documentation. A hospital sitter is a trained professional who provides one-on-one care and supervision to patients in a hospital setting. There are two types of forms. There's a sitter documentation, which is done Q 1 hour, and a qualified professional observation form, which is done every 30 minutes. Here are examples of both of the flow sheets. You will find the sitter documentation flow sheet can be accessed by typing in sitter documentation, and the qualified professional flow sheet can be accessed by typing in qualified professional flow sheet. Generally, a mobility tech or a CNA will perform this documentation. However, it is still the nurse's responsibility to make sure this documentation is being done. And if you're being asked to break a sitter or a mobility tech, you need to be completing this documentation. Education. This is specific to the med-surg, tele, and ICU floors. To add a care plan, you're going to go to patient plan, care plan, and then type in either behavior or non-behavioral restraint. Then you'll document progress by going to patient plan and document progress. This needs to be done once a shift. To add a learning assessment, you'll go to education and create new. And then you're able to go to that education and click on the education tab and click on which education you're documenting on. We will now go ahead and practice the hands-on application of the soft and hard restraints.